Hi, this is Caitlin Astor, nurse practitioner student with Auburn University. I'm gonna do my suture demonstration today, but before I do that, I'm gonna go over some basic rules about sutures. Before the practitioner chooses to suture a wound, it needs to be evaluated whether that wound is actually a candidate for suturing, as it is clean with low infection risk. Do not suture animal bites or other contaminated wounds. Location is also key. Wounds on the face, or especially involving eyes, eyelids, vermilion border of the lips, need to be sent to a cosmetic surgeon. Wounds over joints involving joints, nerves, might need to be seen by a neurosurgeon or an orthopedic surgeon. And deep penetrating wounds are not candidates for suturing. Generally, wounds can be sutured up to 12 to 18 hours after injury. Exception that are wounds on the face, which can be sutured up to 72 hours in low-risk individuals who do not have other comorbidities, as these areas would have poor outcomes without suturing, and there's a great blood supply to the face, so these can be sutured later. For patients, as in maintenance of the sutures, instruct them to keep it clean and dry for 24 hours, cover it with an occlusive dressing. After that, the dressing can be removed and the patient can bathe or shower. It is generally not recommended to immerse the wound in water. It's recommended to avoid swimming pools because it can the soaking in water can soften certain kinds of sutures. Also, avoid swimming in natural bodies of water due to contamination risk. Sometimes it is recommended to apply neomycin or polymyxin topically over sutured wounds. Generally, sutures need to be removed about 5 to 7 days after they were placed. For the non-absorbable ones, the patient needs to be instructed on this so they can return for suture removal. Now I'm gonna begin my demonstration here. Let me also add that the appropriate size sutures are also important. Small sutures such as a 6 would be used on the face and on the hands. Larger sutures such as a 4 or 5 would be used on the scalp, over the extremities. Trunk or extremities can be done with a 3 or a 4, which requires larger sutures. Before suturing, wounds need to be clean, irrigated with sterile water, tap water, or sterile saline. And you have to ensure that all foreign bodies and debris are removed to prevent contamination and promote healing. Also, anesthesia must be provided, either using a topical anesthetic such as lead, lidocaine, epinephrine, and tetracaine. Works well for children. Epinephrine cannot be used on the fingers, toes, ears, nose, and penis. Or wounds can also be infiltrated with 1% lidocaine for anesthesia.
Alright, I'm ready to begin suturing. I got a size 4 nylon monofilament suture here, non-absorbable. And I got my scissors, my needle holder, my forceps. In the office, this would be a sterile procedure. These will be simple interrupted sutures. I'm going to do a surgeon's knot, so yeah, loop this twice around the needle driver and tighten it up. I'm going to repeat it the other way around. Do 4 throws on this to ensure the knot is stable. And then I'm going to cut this at an angle. Let's start on my second one. Sorry, it keeps slipping off. One last one. Okay, I'm gonna cut this off. Like I said, do local anesthesia first, either with LAT, topical, which is lidocaine, epinephrine, and tetracaine, or injected lidocaine. Cannot put epinephrine into fingers, toes, the penis, the nose, and the ears. That's it.